Surgical asepsis is the technique designed to maintain sterility at previously sterilized items and to prevent the introduction of any microorganisms into the body. Purposes: to eliminate all microorganisms as well as vegetative states such as spores from objects that comes in contact with the tissues of the body that are normally sterile, to protect patients from possible infections.
Surgical hand washing or scrubbing. Begin with proper attire. Remove wristwatch and rings. Holding hands above the level of the elbow, wet hands and forearms under running water from fingertips to the elbows. Dispense liberal amount of soap or antiseptic solution into hands. Use a firm, rubbing, circular and interlaced fingers technique from the fingertips to the elbow. Hold the hands and arms under the running water to rinse thoroughly, keeping the hands higher than the elbow. Obtain sterile brush from container. Use the counted brush stroke method. Scrub nails with dirty stroke. And 20 strokes for all skin surfaces. Force surfaces of each finger, thumb to fifth finger. Over palmar surface of the hand, small finger to thumb. Over dorsal surface of the hand, small finger to thumb. Over the wrist. Extend the scrub 2 inches above the elbow, giving elbow a few circular strokes. Rinse the hands and arms so that water flows from the hands to the elbows. Turn off the water with the foot or knee pedal. Wiping hands and arms with sterile towel. Reach down to the opened sterile package and pick up the towel directly as one, holding it away at all times. Dry both hands thoroughly by holding the towel in opposite hand and using an oscillating motion of the arm from fingers up to the elbow. Carefully reverse the towel, still holding it away from the body. Discard the towel. Gowning and close gloving. Pick up the gown in such a manner that hands touch only the inside surface at the neck and shoulder seam. Step back away from the table in unobstructed area and extend the arms at shoulder level. The circulating nurse brings gown over the shoulders by reaching inside to shoulder and arm seams, pulling it securely onto shoulders and tie the neck and back waistline ties. Use your left hand still inside the gown to pick up the folded edge of the right. Hold your right hand out with the palm up still inside the sleeve. Lay the right glove on the right palm. With the left hand, grasp the right glove cuff by the top fold of the cuff end and pull the right glove cuff up and cover the right gown cuff. Adjust the right glove cuff over and right gown cuff, keeping the left hand inside the gown. Pick up the left glove with the glove right hand. Hold left hand palm up inside the gown sleeve. Grasp the top fold of the cuff edge with the glove right hand and pull the glove cuff up and over the gown cuff. Work the left hand. Turn up and adjust the cuffs of both. Pull the glove fingers out at the ends to reposition the fingers if necessary. Establishing and maintaining a sterile field. Wash hands. Choose a flat, hard, dry surface and clear sufficient area on which to prepare a sterile field. Before sterilization, objects are wrapped and the wrapper when open provides a sterile field. Means sterility of the package. Reaching around the package, pinch the first flap on the outside of the wrapper between your thumb and index finger. Side flaps are opened one at a time, opening the top one first. Pull the fourth flap toward you by grasping the corner that is turned down. Hold the package in one hand with the top flap opening away from you. Open the package as prescribed above using the other hand, pulling the corners of the flaps well back. Closing a wrap package, pick up the flap closest to you, handling it at the corner and lay it over the content. Select the side you opened third and repeat for the other side. Use the re-wrap package immediately. Reopen the package by using the method earlier. To open commercially prepared packages, if the flap of the package has an unsealed corner, hold the container in one hand and pull back on the flap with the other hand. If the package has a partially sealed edge, grasp both sides of the edge, one with each hand, and pull apart gently. Adding necessary supplies. To add sterile solution to a sterile bowl, before pouring any liquid, name of the solution 3 times to make sure you have the correct solution. Hold the bottle of fluid at a height of 10 to 15 cm over the bowl and to the side of the sterile field so that as little of the bottle as possible is over the field. Replace the lid securely on the bottle if you plan to use it again. Label it with date and time of opening. Isolation. Check the type of isolation ordered for the patient. Perform hand washing. Gather and arrange all the equipment needed. Identify the patient from the door, and upon entering the room, carry out the aspects of isolation technique necessary for the patient according to the type of isolation used. Explain the procedure to the patient and give care as planned. Carry out the necessary techniques to leave the room. Record on the client's chart those isolation precautions that have been implemented and evaluate the following. Surgical skin preparation. Before clipping, drape the client and expose only the area to be clipped one at a time. For wet shaving, place the moisture-proof towel under the area to be prepared when lather the skin well with a soap solution. Stretch the skin taut and hold the razor at about a 45-degree angle to the skin. Wipe excess hair off the skin with a sponge. Move and repeat steps until the entire area to be prepared is clipped. Cleaning and disinfecting. Clean any body crevices such as the umbilicus, nails, and ear canals with applicators and solutions. Dry with swabs. After clipping, the skin preparation may need to be checked by the nurse in charge. Remove the waterproof towel and bath blanket carefully so as not to spill the clip hairs onto the bed, and document the skin preparation on the client's chart.